We've launched a really major consultation process for this plan that we're developing. We want to hear from as many people as possible to understand what people think should be the priorities for Mind, but also to understand what life with a mental health issue is like at the moment in Britain today. We know that there has been some progress in the past, but we also know that people are facing very many challenges at the moment. So we want to understand that, but we also really want to hear from people to find out what people think Mind should be doing, because everything we do is driven by people with direct experience of mental distress, and so we really want to hear people's voices so that we can create a strong and clear message to people about who Mind is and what we're all about.
I think in future Mind should focus on tackling discrimination in the workplace and also reviewing, along with the DWP and the Department of Health, the benefit forms such as disability living allowance. And if they are going to give people jobs, then people with mental health problems should have just as much rights as other workers. And if they're not going to give people jobs, well, then they should give them more benefit, I suppose.
It is the stigma. Biggest thing there is the stigma from the community, in the Asian community, especially from past Hindus, Muslims, Sikhs, and Christians who are from Asia. Because they don't even want to tell that they are suffering from mental illness, because the mental illness in India, they said is pagal. That's the people who go to asylums. In the old days, they are chained. And why they don't want to tell? Because their sons or daughters are not going to be married. If they are married, they are going to be either divorced or being made fun of that. So stigma is the biggest thing in the Asian community on the mental illness.
There are three main areas. One is to continue to challenge stigma and discrimination. We've made a lot of progress, but stigma and discrimination still is rife. We haven't gotten rid of it. And we're a long way away from getting rid of it, so that still needs to be tackled. The second area is a recognition of the value of positive mental health. That mental health affects everybody, whether you've got good mental health, which needs to be maintained, or whether you're struggling with mental health and you need help to make sure that that problem doesn't actually become a medical problem or doesn't start to pull your life apart. The third issue we need to focus on is the ongoing provision of vital local services. In a time of financial hardship, local mental health services are often the first to suffer and the first to be targeted, and we mustn't allow that to happen.
I think in the future Mind should focus on this idea that's come from Australia, which we've been encouraged in our Mind first aider training, that there is a road to recovery, or additionally there is an ability to manage even serious mental health conditions. I mean, I had a fellow colleague on the council who was, and admittedly, a bipolar. Now, that could not have occurred 40 years ago. So I think we are improving, we are fighting stigma. So, but there's a lot of work to do. So I think Mind should just continue what they're doing. But I do have reservations about this Health Act because, these community treatment orders, I'm very worried about those. But otherwise, I think things are looking hopeful, and we need to really bring forward a sort of hope, of recovery, and also that people can manage serious conditions.
I think the biggest issue for people with mental health problems is discrimination, and particularly with the financial situation and employment, getting a fair deal. And I think organisations like Mind have an important role to play in trying to reduce discrimination and to support people in protesting about discrimination. I think supporting people who've had mental health problems, recognising it and helping people to be open about it so that they don't feel they have to hide a mental health problem because it may lead to discrimination or even to not getting a job.
I'd like mine to focus on more emphasis on rehabilitation and more emphasis on understanding and respecting people's emotional needs, not just psychosis. Psychosis is only one aspect of mental health needs. It's only one aspect of psychiatric care, but all systems seem to be geared towards psychotic illness and not enough towards emotional illness and all the other spectrum of psychological illness.
Well, the biggest problem for people with emotional distress is communicating that. And the biggest problem possibly for the other side that receives that communication to help is not being able to listen properly and not having the facilities for the person who's got the problem to feel safe. And listening and feeling safe is a very important thing. Young people are the future of mental health. We're living in hard times, unemployment, family disruption, all kinds of things. But the younger people now are going down with emotional distress. They're the people that we need to look at. And it's not necessarily the older people with the experience that can give them that help. They need to be put in a really good free space where they can find out what it is for themselves, emotional distress, and how they can solve it. They've got their own values, language, communication, ways of doing it. And we need to make a space for them. I've got, I don't want to say too much personally, but I know, but it's very important, to look at younger people's problem, not to think that we know best. That's wrong. Actually ask them what it is for them. Even if it's a jumble, out of that jumble can come some articulation about what their needs are.
I think in the future, Mind should focus on some of the things it's focusing on now, this thing about stigma and discrimination, because that also brings in the notion of inclusion and diversity, and those two things are significant in respect of ensuring that our society takes care of all its members. So we tackle stigma and discrimination. It means that we don't say that people who are mentally ill are excluded from society. Black people who are currently overrepresented in our mental health system, hopefully that would be changed. Discrimination generally would decrease, enabling more people to actually engage more appropriately in our society in their own rights.